Welcome to Healthcare Corner, where conversation and healthcare meet. Proactive choices, empowered decisions. Join us with your hosts, Gavin, Ed, and Guillermo.
Welcome back, everybody, to our Healthcare Corner show, and we're excited to talk about all things healthcare, and especially today we're going to be talking about assisted living and what that means for a lot of us here in San Diego who do not necessarily have all the resources they need at home and need to look at other options. And with me today are our guest hosts, Ed Nahara and Dr. Guillermo Castillo. So welcome, gentlemen.
It's good to see you.
Good to see you, Gavin. Good to see you, Guillermo.
Yeah, absolutely. And our special guest today is Rajni Kharbanda. She's the owner-operator of Coronado Retirement Village. Welcome, Rajni.
Well, thank you so much. It's a pleasure to be here.
Well, we each week want to have experts that are really able to help our audience know more about the different topics we're talking about. And last week we talked about telemedicine and forward thinking, and we're so grateful that you could join us this week because we know of the programs that you're utilizing at your community and how to keep your residents safe in your community.
Thank you.
So thank you for being here. For all of our listeners out there, we'd love for you to write into the show. That's at info@hcshow.net. And what we found out last week is that some of our listeners really wanted to learn more about just the definitions of what we're talking about. And so this week we're going to do a better job of explaining the difference and giving you a definition so that our listeners have a better place to go from. So this week, what we'd like to talk about is senior living. What does that mean? It has multiple topics. You have independent living, assisted living, memory care, and then there's also skilled nursing. And so, Dr. Castillo, I know that you've seen patients at each one of those levels. Could you define loosely what each one of those levels means?
Sure, absolutely. And I think we'll get into it more with our guest here later, Rajni. But from my standpoint, I mean, I've been seeing these patients all along. And I've started, like I said, in the last show, I've seen patients in their home. And I get the question a lot. You know, at what point do we seek help, and where do we send our parents, all right, or our grandparents? So there's a whole lot, like I said, Gavin, there's different options. So the independent level are still for people who need some place to live and they need some supervision, maybe reminders to take their medicine, but they're usually pretty functioning. So they can feed themselves, they can bathe themselves, they can go to the bathroom, they can put themselves to bed, right? At the assisted level, they need a little bit more assistance. So maybe they need somebody to kind of help them get out of bed, help them bathe, help them get their meals, those kind of things. And then when it comes to the memory care, those are people who start to wander, right? So they need to be in a unit that's more supervised, that they can't access certain areas. They can't just leave out in the street. And then the skilled nursing is when do they need more, when they need IVs or certain medications that can only be given by nurses, or they need physical therapy or more pronounced medical care.
Excellent. And how is the communication with those different levels with you as the provider? Is it consistent? Does it vary upon provider, or how would our audience benefit from knowing how a doctor interacts with each one of those levels?
Absolutely. At the for me as a physician, like I said, I worked at all these levels. There's visits at all levels, but how frequent and how available the doctor is what varies. For example, at the skilled nursing facility, by law, we only have to see, as a physician, the clients once a month. Right. When it comes to the assisted living facility, they like us to come out once a month, but I think every other month's acceptable by the law. And at the independent level, it's just like being at home, right? It just depends on when you make an appointment. And if you see the doctor, you can usually still mobile. So you should be able to go into the doctor's office and see them. As opposed to the other ones, the other facilities, the doctor should come to you.
That's right. And so today what we wanted to touch on, and thank you for that analysis, Doctor, and why we're so excited to have Rajni in the booth with us is that we wanted to touch upon some of those key pain points that maybe prohibit people from even starting to talk about this conversation, and to be able to really give our listeners a chance to make an actionable decision on what type of level of care is best. Rajni, we'd love for you to just give us your background a little bit and tell us about the levels of care that you provide at Coronado Retirement Village, please.
Thank you, Gavin. I came to United States at a very young age, and always knew that healthcare was something to do with my career. Even though I started as an entrepreneur in different directions of retail and other businesses. But then I landed into senior care living, which is because I also took care of my mother-in-law, and I was a direct caregiver also to my mom with dementia. So it's just too close to home. You just kind of feel. And I run this and operate and run this business just like I would want my parents to have the quality of life. That's exactly how we do for our residents here. So thank you for having us on the show. And the factors that I'm seeing, as Dr. Cascio put it out there, the difference between each level of between nursing home and assisted living, there are times when families don't have the direction. And there's a lot of anxiety about it, leaving home in their comfort zone. And then lately we noticed they come to us very late in their lives. They wait till they are 2 persons transfers, or they have multiple falls, or had elopement. And at that level, it just kinds of, becomes much harder for many family members to take care of them. But at Coronado, we take care of all levels. We do up to hospice. This is basically their home.
Right. And but there is no skilled nursing on
It's a non-medical model, but yet there's a lot of, insurance dictated things are changed. So we do get residents here at some levels that may not be quite skilled, but very heavy care.
Right. And I think that's a great point that we'll bring up in the next segment. We'll tease out the difference between a social model of assisted living and a more medical model, and then the difference between those two, and then also skilled nursing. But the acuity or the difficulty of the patient it changes about every 5 years that I've noticed, and I'm sure you have your own opinion as well. But what we saw in skilled nursing 5 years ago, now you're dealing with at the assisted living.
Exactly. Yes, that's true.
And so how you're handling that from hospice, from maybe sliding scale,
diabetes,
yes, and that sort of thing. So, are you hiring more licensed vocational nurses and that sort of thing to be able to support with those?
We have a lot of home health and visiting nurses and mobile doctors, podiatrists, psychiatrists, all levels of healthcare providers have been visiting and providing their cares to the patients. We also have an on-site physical therapy, as called gentle fitness. Excellent. So to help them with the balance and gait.
Excellent. And I think that's appropriate too, because when we're aging, right, we have to be able to have the different options and be proactive about our care. And so I think with some of the things we'll touch upon in the second half of the show, autumn care and remote patient monitoring and some of those great systems that you're putting in place, people can age safely and have a better quality of life at Coronado.
Correct. That's right. We are going with the changes too. We are monitoring what the level of care is coming. Our staff is trained based on those requirements for the residents. And autumn care is definitely something we see as a need for those, because not everybody falls under this big dementia phase. They all have, some are very mild, can be easily monitored in an assisted living.
Certainly.
I think, and independent of any of those factors, right? Just living in Coronado improves your quality of care and your quality of life.
That's true. Right. It's like being on a vacation on it every day. That's for sure.
It's a cruise ship on land, right? Absolutely.
That's the goal.
So,
your own bridge.
Excellent. Ed?
Yeah. I said you have your own bridge as well. So.
That's right.
We can tell the traffic far away. We know it's a traffic day.
Yeah. So
two ways in.
One of the beautiful things about San Diego, right? And so those are some of the things where we have great weather. We have some of the things that maybe other people in other parts of the country that are tuning into the podcast, they deal with that we don't. But truly, it's a really beautiful part of the county. And
oh, it is. We call it a hidden treasure. Coronado is just nestled in this beautiful island with all the historic Bay Bridge view. It's beautiful.
And I think what we also want to touch upon are all the veterans that we're able to serve.
Absolutely.
And you look at some of the programs that are there for them, like aid and attendance, and ways to be able to fund their stay so that they wouldn't have to go to a Medicare facility like skilled nursing, where it's a lower quality of life, but that they would have an option to be able to enjoy all the comforts that you get from Coronado Retirement
Absolutely.
Village.
We celebrate our veterans a lot, because we have almost 20 veterans right now in the residents that we are serving. And they all have been amazing. And they got pinned in the last, the color guard ceremony we did last Veterans in 2019. And we're looking forward to do another one. Hopefully with the COVID, we can keep the social distance and still do our celebrations.
That's excellent. That's excellent. And I think other key points that we want to talk about starting in the next segment, we want to talk about what geography is as far as your family. So how close people are typically to their families, and so loved ones, and how they visit. We'd maybe like to talk about with you what you've been doing during COVID to be able to support your family members.